You're tuning into the Active Mom Podcast with physical therapist, Dr. Carey Pagliano, a real mom's guide to all things postpartum return to workouts after baby. If you're a postpartum mom, coach, trainer, or physical therapist looking for answers on how to get back to running, CrossFit, yoga, Pilates, HIIT, you name it, without the fear of pelvic floor issues or doing something wrong, this is the podcast for you. Let's start the show. All right, so I am always looking for new guests. And a couple of months ago, Tom Goom, who is running Guru Extraordinaire, he had done a post, and I was super excited about it, on kind of what to understand about menopause in runners. I almost said older, and I'm like, no, I'm not older. In more masters runners, let's put it that way. And he had referenced a paper by Dr. Carey Rothschild, and it was entitled Maximizing Running Participation and Performance Through Menopause. I'm like, I do not know this person. Let's go find her. And lo and behold, she had a cute little clinical commentary in the Journal of Women's and Pelvic Physical Therapy, which is our journal here in the States. And I was like, okay, we need to do a little bit more hunting. And so I reached out and I said, come on the show. And she said, yes. So other than, talking about cool stuff, she also has a very cool name, Dr. Carey Rothschild. Thank you so much for being on the show.
Yes, thanks for having me. I'm happy we connected over this article. That's great.
Exactly. Okay, most important question. How many times have you had your first name misspelled?
Oh, I don't know. I cannot count that much. I mean, I'm lucky if I get the C versus the K. So I know it's been an ongoing thing since birth.
Yes. No, as children of the 70s, we had Carie, Carrie, Kari.
Maybe Kerry.
Yes, Kerri. Like
Mhm.
all the ways. So
All the variations.
congratulations on keeping it.
And I've
very
got
confusing
Carey
name.
because my parents knew somebody who spelled it that way.
Oh, really? I
Yeah.
don't know. Okay, so second most important question, what's your middle name?
It's Elizabeth.
Okay, close. Okay. Mine was Lynn. It's switched now because of name changes and that kind of stuff.
Yes.
But I also feel like the 70s had such clutch middle names, and like
Yes.
everybody has Lynn or Elizabeth or Rachel
Yes.
or something like that.
Yes,
So.
a very, very common pool of names.
All right. So now that we've clarified you have the coolest name ever, tell us a little bit about one, who you are, and two, how did you get interested in writing about running in menopause?
Yes. Well, thanks again. I am a physical therapist first. I am an educator, associate professor at the University of Central Florida in Orlando. I've been teaching for about 15 years, and I have board certifications in orthopedics and in sports physical therapy through the American Board of Physical Therapy Specialties. And I also earned a certificate of achievement in pelvic health in 2020 from the Academy of Pelvic Health at APTA. So I myself am a runner. I was a former swimmer turned triathlete turned marathon runner. And, I kind of got into this space. I was a little bit in the postpartum space for quite a while. And then I've been running with the same crew of people for quite some time. And we're all kind of recognizing that the training that we were doing wasn't reaping the benefits whatsoever. We were kind of grinding and doing the same thing over and over and over again, and just fallen flat every single time. So I was really curious to know what's going on with aging, what's going on with menopause, hormone changes. So I thought I'm gonna investigate this a little bit more. And I was starting to see some clients too who were also having some menopause transition changes. And I was really curious to see how we could set our, aging athletes, if you will, or female athletes, because there's so many women now participating in endurance athletics and even just recreational athletics that still want to be competitive, whether they're playing pickleball or they want to run and do endurance events. That there's got to be a little bit better recipe for training to help these women be successful.
Yeah. No, and I think it hits different when you have skin in the game, which is not, I don't know about you, but that was not what I was planning going into PT school.
Sure.
We always all wanted to help people,
Yes, absolutely. It started with that.
Exactly. And then because you are also a member of the class of 1999, we
Yes.
also fell flat on our faces with no jobs after we graduated and had to change course.
100%.
Thank you, managed care.
Yes.
But I think menopause is such an interesting thing for our profession because I mean, I guess stereotypically is somewhat quote owned by pelvic health. I mean, that was part of my women's health certification, like albeit a very, very small part. But I
Mhm.
feel like it kind of gets owned, or it should be owned or discussed by everybody. Everybody should kind of have some basic knowledge. And your paper kind of goes over a lot of just like different systemic aspects of this. So maybe we can kind of hit some of the big areas where you thought, women really need to pay attention because there's going to be changes here. But then also
Mhm.
speaking to the professionals that are listening, like if you're not currently working, well, you're working with this population whether you realize it or not. But like,
Mhm.
what should we be paying attention to, and where do we maybe need to hone up on some of our background and education a little bit better?
Absolutely. And I think, whether you're an athlete yourself or you are a clinician working with individuals, I think that, a couple areas we highlight in the paper are just aging, right? So we're looking at aging, but because of the decline in estrogen, that aging effect is magnified really
Yeah.
because we're losing that estrogen as a female simultaneously with the normal age related changes that we see. So I think every healthcare professional that treats females,
Yeah.
especially adult females,
Yep.
really need to be thinking about what is going on with that hormone profile and recognizing that estrogen deficiency is going to lead to some changes cardiovascular, lead to changes in skeletal bone mass and lean muscle mass, and also changes that are related to the genitourinary system that might lead to or be a result of the changes related to estrogen deficiency. So,
Yep.
and then most recently, as I'm coming to learn, is musculoskeletal pain. So, if you're a physical therapist and you are treating a patient who comes in with shoulder pain, it may have nothing to do really with the shoulder. And in fact, frozen shoulder can be associated with the female sex,
Yep.
along with a lot of orthopedic conditions. And I get to teach orthopedic physical therapy in my program. And we go through risk factors for all these different conditions.
Yeah.
And you see female sex, female sex, female sex for carpal tunnel, female sex for frozen shoulder, female sex for neck pain, for back pain. And it's crazy how, wow, the age of diagnosis sometimes seems to be in those late 40s, early 50s. Well,
Right.
that's a very, very peculiar coincidence. So, from the athletic perspective, how do we keep training? How we can keep doing these activities that maybe we've done through our 20s and 30s and keep the volume going or keep the intensity going? What do we need to do differently? And what kind of supports are there for our bodies as we age?
Yeah. And I don't know about you. I mean, the program that I went through, one, I don't ever remember the talking about estrogen once.
No.
And if female came up as a risk factor, in my head, I didn't equate to estrogen. And then also,
Mhm.
I feel like our understanding of the role estrogen plays in our bodies, it's not just what makes us female. It's not this sex hormone. It's not even just a pregnancy related hormone. It's so many other things. And you touched on a
Absolutely.
couple of systems. So maybe let's start with cardiovascular.
Sure.
And I'll give you just a quick story because we were chatting before we came on about we're a similar vintage, which is what we're choosing to call it.
Love it.
That I've had some blood pressure issues recently,
Mhm.
and I've been trying to share them as much as possible because, like, the average person, you don't keep track of that. Maybe if you go to a GP, and how many
Mhm.
moms have time to, make those appointments for themselves because they're busy doing other stuff. But like, do you know
Mhm.
your basic stats? So
Right.
let's talk a little bit about kind of the impact of cardiovascular health.
Sure, absolutely. So, I mean, clearly the capacity for VO2 max is going to decline with age. The other thing that's unique to females is that the lipid profile changes as well. And so there's, an increase in your LDL cholesterol and increased possible risk for atherosclerosis. And, those things may go undiagnosed if you're an athlete and you're trying to hit certain numbers and try to get to a certain level of intensity during a workout, or you're not able to, it could be related to these changes that are
Mm,
not there. So maybe you're trying to hit a certain time on, some intervals and you just aren't there. You used to do it 5, 10 years ago, but this time
right.
you can't do it. And your capacity for that VO2 max declines. And so that's something that you've got to extend grace to yourself and to your patients that might have some frustrations with that. So what do we do about that? Well, we're going to do those things in smaller, shorter bursts, still get the intensity, but maybe not go quite as long, but still get the benefits for that robust cardiac activity.
There was something you mentioned in the paper about a potential correlation between cardiovascular status, I think, and vasomotor symptoms.
Yes. And vasomotor symptoms are still not 100% understood. But yes, there can be somewhat of a little bit of a cardiovascular correlation because there are these changes to the cardiovascular system regarding the vessel patency and things of that nature. And so I think that when we see some of those the decline in estrogen, we start to get some of those relationships to the vasomotor symptoms. What's happening with the vessels is kind of causing this response in these hot flashes that are can be very, very debilitating for some individuals.
Yeah, mine wasn't exactly a flash. It was kind of, I was just blaming my dog for being hot because she sleeps on my neck. She's like a little 18-pound border terrier, but we'd had her for 4 years. So that really kind of didn't make sense. You know what I would love to know though, and I don't expect you to have an answer for this, but I wonder someday if people did a study looking at correlation of intensity of vasomotor symptoms after, like in postpartum. Comparative, like, is there any sort of correlation to the intensity that you would have in perimenopause?
Yeah, I don't know that it's been looked at.
Oh, no. Well, I mean, with all this stuff too, and I'm sure that the thought occurred to you as well, is like, the more we kind of dive into this perimenopause, menopause stuff, it makes me go back and completely rethink postpartum because it's all low estrogen state. And that was the one thing that the one of many that no one told me about is you wake up completely drenched in sweat, a week, 2 weeks, whatever, after giving birth. Plus you've got milk coming out, you're bleeding, like all that stuff. Like no one told me about that one.
Absolutely.
And it's the same thing, right?
I know. I mean, like across the continuum, it's kind of like, well, what kind of baseline did you have?
Right.
And then where are you now? So almost if we go back to sports medicine, it's like, well, you have concussion testing, you get a baseline, then you have an episode, and then you have like what's happened next. And it'd be nice to see it across the continuum of the lifespan.
Maybe we're currently doing that test right now. I don't know.
Maybe we are. Maybe it's something for the future. We'll bookmark it.
Exactly. All right. So for the average, so what you're saying is like for the average runner, you're going into perimenopause, one of the first things that you might see too is just difficulty hitting those interval times, things like that. With some, and I think that this is a tricky thing too with the recommendations that are out there, because I feel like it's all over the place. You've got some people saying, do HIIT and sprint training to get that intensity. Zone 2 is bad. Like zone 2 is good. Like, I mean, you can find,
whatever you want to find, you can find.
Exactly. You can find it. And I think it's incredibly confusing. And for those of us in that space, I feel like it's confusing. I can't imagine what it's like for the average woman trying to be like, all right, well, I've always run. Now you're telling me I've got to do something different here. What, from a cardiac perspective, might be beneficial for this population?
Sure. I mean, I think that it really is going to depend on the individual's goals. If their goal is just to go out, do some social running and just continue to maintain, I think they can continue to do that without really any other changes. But if somebody is trying to hit a qualifying time, for example, the Boston Marathon, and they need to be able to do some training at a higher or faster pace, then they're going to have to probably chunk it up a little bit more rather than doing the long endurance. I think that when, at one point, I know when I was early running and I was pregnant, there was a big recommendation to use a heart rate monitor. And, that can be helpful. So you can kind of have an idea of how hard your heart is working. And then, you're looking at the rest period. The rest period is really something to be considering during perimenopause, and making sure that you give adequate recovery, because the tissues and the heart just needs a little bit more time to recover. So I think that was something new for me personally when I was kind of adjusting my own training and thinking, well, I need to do these intervals, but I think I need more rest than I'm
Mm,
used to. So instead of taking, a minute or two, maybe you're taking 3 or 4 minutes so that you can be more recovered before you start the next interval.
right. And that doesn't make you weaker. That just makes you training more specifically for your
Exactly.
current circumstance. Yeah.
Exactly. And
Yeah.
my body's not what it was in its 30s. And so now here I am in the late 40s. And so it would make sense. I might need to do some adjustments. And
Yeah.
yeah. And so I think that's one of the biggest things people can give themselves is a little grace and let themselves recover a little bit more. And, instead of doing, I can't imagine doing 70 or 80 miles a week as a runner now, because maybe you need to get by with a little less and get more quality out of it rather than
Right.
more and maybe not as good quality.
That's interesting because I'm going to take a little side trip here.
Sure.
There's kind of a group of women. I think they're just a little bit older than us, so they're probably
Mhm.
like 50s, early 60s, that
Mhm.
were part of that like OG group of we run
Yeah.
and we're going to run for a really long time.
Mhm. Mhm.
And what I have noticed recently is more of them are saying, I'm out. I'm gonna go do
Mm.
gravel. I'm gonna go do this. And they're not only burnt
Mm.
out
Yes.
mentally,
Yeah.
but they're burnt out physically. And I don't know if it's because they've done the same thing for so long or that they get
Okay.
to this stage and because they've done the same thing for so long and it's worked, they're at a certain point where it's not working
Sure.
and they're not used to accommodating. So they're like, all right, I'm out because I can't do
Yeah.
that
Well,
same
and
thing
if
again.
they're only used to running,
Right.
and that's another point in the paper is that we really need to be supplementing our endurance-based work with
Yep.
strength training. And so that might be part of the issue is that they
Yes.
feel flat. They don't have really the robust strength that they need to continue to doing what they had been doing for years. And
Yep.
if they were to sprinkle in maybe a little strength training twice a week,
Yep.
that might make a big difference in their
Yeah.
ability to continue their program.
Yeah, and I think that's a reflection too of, it's almost like a parallel journey, and you've
Mhm.
run long enough that you would know this is like
Mhm.
runners used to just run. We never used to
Right.
talk about other
Yes,
training, and now we have such great data to say,
absolutely.
"Hey, you need to lift heavy. Resistance training is good. It's gonna improve your performance. It's
Absolutely.
gonna, good stress on bone, good stress on tendon," those
Mhm.
sorts of things. Like,
Mhm.
we have all this that it kinda came along to some degree in parallel.
Uh-huh.
Um,
Yes.
but you also now have to be like, all right, well, now let's also take what we know about we need to lift
Mhm.
in with menopause. Like we need to be having these conversations way sooner, almost with our young athletes, like our
Absolutely.
girls, and be like, get
Yes.
used to lifting now
Mhm.
so that you can keep lifting. So that
Mhm.
eventually, I had a colleague of mine, Christina Previtt, who's a researcher up in Canada, and
Mhm.
we had the same conversation. She has a daughter as well, and we're like,
Yeah.
because she does geriatric and then postpartum research, and she's like,
Mhm.
the bone health that you have as an older adult, that starts when you're a kid. And I was like, oh
Does.
my gosh,
It does.
right?
Yes. Yes. I know I have a 15-year-old and she plays soccer. And
Okay.
once a week they do strength training. She hates going. She hates it. She complains about it every
Oh
week.
my
And
gosh.
I just said, listen, this is your prevention. This is your injury
Yeah.
prevention right here. And this is also your bone building for life. And of
Yep.
course, the 15-year-old brain doesn't understand that whatsoever.
Right, exactly. I
So,
remember I went to 2 different high schools. My second high school, our coach was awesome. He was our cross country coach, our Nordic ski coach, and then the guys track coach. And I
mhm,
remember he brought us in the weight room, and I think we were just doing bench press or something like
yeah,
super basic.
mhm,
And being under a barbell, I just felt so badass, and that just kinda stuck with me. And then years
absolutely.
later, I was able to kinda come back to it. But like, did you have like a sport? What sports did you do growing up? And did you have
I was a
any of that
competitive
connection?
swimmer, and so
Ah,
I
okay.
swam a ton, but we did a lot of dry land training too.
Yeah.
And so I remember starting to lift weights probably when I was 12 or 13.
Yep.
We had probably 2 training sessions. I mean, we started with a lot of resistance bands and,
Mhm.
especially rotator cuff exercises
Yes.
for swimming. But yeah, I was learning some of those things at an early age. So then you learn the form earlier and it
Yep.
becomes part of your lifestyle. I think it's super hard for people that have been sedentary to say, okay, I'm going to go lift heavy weights now.
Yep.
And my mother is 78, and she lives in the Villages, which is a popular retirement community here in Florida. And they have lots of classes. And she's got one that's called bone building. And I say, Mom, what do you do in bone building? And it's very lightweight. And I'm like, have they encouraged you to lift weights, like heavier weights? It's more like chair aerobics. And that isn't really going to make her bones much stronger really at this point.
Yep.
And so I always encourage her, like, go for the highest amount of weight that's available.
Yep.
Don't sell yourself short. Try to use that to your advantage and help you get stronger. So
yeah, no, I think that's a great kind of wrap to that, because it's been coming up and strengthening. Now we've got to go back like to the menopausal stereotypes and being like, okay, we've got to do more.
Yes, I know. I think I was reading a statistic. It's 10 to 12% of your bone mass is lost within the first few years of menopause or during menopause transition. And I'm like, I looked at that number again. I'm like, man, that is really a large percentage.
Mm-hmm.
You got to do things. You've got to do something to stimulate the bone during that time frame.
Well, and this is the other thing too, because I know you're dropping off at practices and things like that.
Yeah.
How many moms do you see walking around in walking boots right now?
A few, not as many in Florida, but yes.
Okay. Well, in Virginia, apparently we're doing a lot, but no, it's like, I have friends all the time with bone stress injuries. And again, it's our age
orthopedic walking boot. Yes. I know several people. I'm sorry. I thought you were talking about like stylish boots, but no.
Oh, no.
Walking boots. Yes. Orthopedic boots.
This is the extent of my passion.
Three friends right now that they are out of commission. Yes.
Yeah, but like it's the same thing that we're getting this reduced bone density. People aren't aware of it. They have these bone stress injuries, and they're like, I don't know, I was just on the treadmill, and they don't think twice about it.
Absolutely.
What thoughts do you have? Because I think people want to do the right thing, and I live in the DC metro area, so we have a lot of type A people, including myself, and so we're like, okay, let's learn all this stuff, do all the right stuff.
Yeah.
Talk to me a little bit about kind of lifting weights versus everybody's talking about jumping now. And there's what we know about it with running performance, which I think is really interesting. And then there's also what we know from kind of this age and stage with the perimenopause, menopause conversation. Tell me kind of your thoughts.
Yeah, I mean, I think I go back to, the American College of Sports Medicine guidelines. We've got to get our basic 150 minutes of aerobic activity, moderate to vigorous intensity. And then we look at strength. And I think we have to consider what's the benefit. And are we looking for hypertrophy? Are we looking for strength building? Are we looking for power? And so I do think it could be advantageous to add in some power, especially because when we talk about the tendon aging, that also occurs with the perimenopause state, that loading the tendons is beneficial for sure. So I don't think it needs to be every day. I think, guidelines would suggest doing it twice a week, where you are trying to load the tendon, specifically, Achilles tendon, patellar tendon, those types of things through some plyometric activity. So is that going to help stimulate bone? Yes, absolutely. Is it going to also help stimulate the tendon? For sure. And so we do see a lot of tendinopathies, and we see a lot of tendon tears, and we see muscle tears in the 40s and 50s. And I think that could be preventative. So I hope that answers your question there.
Yeah. I have some people that think that they are interchangeable, that lifting weights or wearing a weight vest or something like that, is that interchangeable with jumping? Or is it like, oh, I jump, it's enough?
I think no. I mean, when you think about plyometrics and the definition of plyometrics, it is doing some lengthening with rapid speed and eccentric control on the descent, if you will. So I think it's still totally different. I think there's a separate space for it. I don't think it needs to be, an hour-long session. I think you incorporate 10 to 15 minutes in with your strength training days, and I think that would be probably sufficient to get started. And then perhaps if your goals require that you do more, if you're going to join competitive, basketball or volleyball at some point, in your adult life, then maybe you need to do it a little bit more. But I do think we've got to put the pounds on the dumbbells and the barbells and make sure that we're still doing the traditional strength training.
Yeah, no, I think so too. And what I always try and do with masters athletes is we talk about it from a menopause perspective, but then I go back and make the correlation in running performance. And there's been a couple papers
Yes.
looking at comparing those two, and you're going to get better time trial performance. I think it's with heavy lifting versus plyometrics. And so I'm like, so we still got to lift up the weights.
Still got to lift up the weights, and you still got to keep your tendons healthy,
Right.
so that you don't get the injury, but you still
Right.
got to lift the weights. Absolutely.
Yeah.
Absolutely.
So for you, like, what are your thoughts? If somebody, it's a foreign concept to them, they didn't have the, early
Right.
experiences that we did, what would be an easy way to start that? How heavy is heavy? Should I lift free weights? Should I do machines? Like, what are thoughts that you have about how to start that process and then make it consistent? Because that's really what we're looking for, is the consistency.
Well, I think I definitely have to use some motivational interviewing in that capacity to see for sure, like, what
You're such
are
a teacher.
Yes, I really am. I know. What is the individual's goals, and like, why are they doing this? Are they doing this because they're trying to stay healthy for their kids? Are they doing this because they actually want to be competitive and do something more like that? Are they really just trying to get off the couch and just be a little bit more physically active? I think it's probably a common saying is that the right exercise is the one that patient's going to do.
Yeah.
Or the one the individual is going to do. So if they have a phobia against dumbbells and barbells, then I think we're going to have to try something else.
Yep.
Maybe a weighted vest would be good for that person. They could start with a weighted vest and do compound movements and do some squats and do some lunges and some step ups and things of that nature. So I think it depends on what kind of equipment they have access to and what they actually would be willing to do. I think body weight could be a good starting place if someone's done nothing. But if they've been seasoned, then, and maybe they've been doing the same 3 sets of 10 on the leg extension machine, maybe it's time to let's reduce the amount of reps and get them down to 4 to 6 reps and increase that load. And I think a lot of women are not accustomed to lifting like that.
Right.
Sometimes it's just amount of taking the reps away and increasing the load, and then therefore they can actually get some more bang for their buck, but they're doing less reps.
Right.
Yeah.
Right.
So,
I think it's a fear thing to your point. Like, even women who have just kind of started working out, and they'll be taught, 3 sets of 10, and they want to get through it comfortably.
That's right.
And that's very different than what we're looking for to make these gains. What were you able to find for your paper as far as kind of like recommendations, as far as, is it like RPE? Is it percentage of like how do people figure that out?
Yeah, I mean, it's really not feasible to do 1 rep max in a clinical setting, really, or in a gym setting per se.
Yeah.
Another thing that's come up is using reps in reserve. And so, using 2 reps in reserve. So once you get to number 8, like, do you have 2 reps in reserve? I don't think I talked about that in my paper, but sometimes that can be like, let's say you want to give the individual 3 sets of 6 and they get to 6 and they're like, okay, that wasn't too bad. But could they do 2 more? So kind of having that thought process, like, could they do 2 more reps? And if they could, then they probably are comfortable enough to do what you're prescribing. But if they could do more than 2 more, then it's probably not heavy enough.
Yeah.
Yeah.
Well, and with that too, this kind of circles back to what you were talking about cardiovascular wise too. Like, people don't realize that rest is a part of lifting as well.
Absolutely. Absolutely. And you look in those ACSM guidelines, and when you're doing hypertrophy training, you're doing power training, you're doing like really trying to load the body. You can't just sit on the machine for 15 seconds and then get into the next rep. You've got to go to the next set. You've got to go ahead and sit for 2-3 minutes so that you can be ready and robust for the next round.
Right. Well, and it's funny because if you don't understand that and you go into a gym or go to a class and it's programmed to have like this rest, and people are just like standing around, look at their phones or something like that, you're like, really, what are they actually doing?
Yes.
I'm really lucky. I go to a gym here that it's not a CrossFit affiliate, but it does very similar kind of programming. Our one of our owners was he was a Olympic bobsledder for the Virgin Islands, which is super cool.
Yeah.
He's got young kids. His wife was a gymnast. Like, it's good programming. But what I like is there's really concerted rest, and we have these different rep schemes that allow us to, like,
Yes.
as we progress through that cycle, like,
Mhm.
there's a really clear goal, what we're trying to do. And so we get that, and then we'll get mixed in, the HIIT or the sprint training or
Mhm.
something like that. So I get to kind of
Absolutely.
check that box, which is
Yeah,
nice.
it sounds like a good recipe. Yeah.
I like it. Well, and again,
Mhm.
that's the other thing to I do think that there's been a big shift in how we perceive, um, at least here in the States, like, going to a gym and,
Mhm.
working out harder. Like I
Yeah.
feel like there's more gyms than ever. Now, granted, I live in Arlington, and we're the
Sure.
fittest city in the
Oh,
country a couple years
right.
running. I
That's
don't know.
because you live there. No.
Right. Well, right now we're a little intense here, so we need to we need to like loosen up a little bit.
Love it.
But no, like there are so many gyms. I feel like every like
Yes.
month or two, I'm like, okay, what's that gym? What's this? Like, is it that way where you are, that you feel like there's a shift? I mean, I
I
know Orlando's a little different than DC, but
Yeah, I mean, I think I see, that we definitely have our CrossFits, we've got the
mhm.
F45s, we've
Yes, we
got
got that too. Yep.
yeah, we've got a couple other, we still have some cycling gyms, we still have
Mhm.
some, kind of like hip gyms that I see
Yep.
popping up. But, I think for females, like for women, a lot of times it's socially driven and the
Yes.
classes can be helpful.
Mhm.
I personally go to the YMCA and they offer a lot of classes and, they might be a body pump and they get a little bit of a cardio and a little bit
Mhm.
of strength training. But I don't think there's ever any instruction to try to do more
Right.
load. And I think that
Right.
there's probably, as you mentioned, and we've already discussed, a little bit of a fear
Yep.
in going heavy. And again, there's been a lot of when you look at the individual and you look at female stereotypes throughout the years, is thinness is in and muscles
Yeah,
are out. But I do think the pendulum's starting to swing a little bit where
I think
muscles
so.
are in and
Yep.
thin and frail is definitely not the way to go.
Yeah, no, I definitely
Mhm.
agree. We've got, here locally, we've got a couple of gyms that are female only, which I
Mhm.
love,
Mhm.
because it's very supportive, and they have hair ties in their bathroom, which I think is awesome.
I love
So
it. Can never have too many emergency hair
no,
ties.
you can never have enough, especially with daughters too, because they wanna steal yours.
That's
But,
right. That's right.
no, I do think that there's much more of a kind of open, accepting space at a lot of different ages and stages to get women so that they feel comfortable. Because again, like, I remember,
Mhm.
even in PT school, going to like a Gold's Gym or something,
Oh,
and
right.
it was just very male,
Male
very like
dominated.
those very thin, tank tops. You know what I'm talking
Muscle
about? Like them.
tops,
Oh
yeah.
yeah, it was the
Uh-huh.
90s.
Yes.
Very Arnold Schwarzenegger.
That's right, that's right. Yeah, I know. I agree, I agree that to find a female weightlifter in a gym
Mhm.
is not that common.
No. I
Mhm.
know. I do remember we did go to one gym and kind of look at, I forget what equipment it was called, but I think we had one session in PT school in like Therax or something like that, that we went
Okay.
to this gym and they let us try stuff out. But again,
Yeah.
it was and I went and worked there for like a year, I think, just worked the
Oh,
front
wow.
desk, and it
Yeah.
was it was very, even though it was in a college part of town, still very
S
dude. Very, very
Male
bro.
dominated.
Yeah. So we're gonna take over the world. All right, let's move on a little bit to kind of endocrine system and nutrition.
Yes.
Let's dive into those. Take us away.
Yes, well, of course. So my collaborator on the paper, Tara Collingwood, she is a registered dietitian and specifically does sports dietetics. And so, we're thinking about that recovery piece and really the needs that the female has during perimenopause to upping the protein.
Yes.
We hear a lot about that. It's like, well, why do we need the protein? We need the protein because we're rapidly losing muscle mass. And
Yeah.
so, in order to maintain that, we've got to replenish and bump up the amount of protein that we consume on a daily basis.
Yeah.
So,
That one, I think, is another one of those that, again, women come in with good intentions. I have a mom friend. We were talking. I really can't get away from this topic anywhere I go,
I,
and
I bet, I bet
I
you're
just
you're the
can't.
most medical they know, so you get the advice questions for sure.
But I was talking to a friend, and she's like, "Talk to me about this protein thing." And so, literally, there's people telling you you need to be eating your body weight in grams of
Hmm.
protein, and
Hmm.
these poor women, they don't realize they're only probably on a normal basis getting like 30 to 40 grams. So to go from
Right.
that to like
Right.
100, like to get 100 more grams,
Mhm.
like you're going to
Mhm.
spend your entire day eating a chicken and like,
Absolutely.
which is not sustainable. So I
It's
feel
not.
like, again, a lot of these things, it's like exercise too. We go in with the good intentions of we want to do the right thing.
Mhm.
And then the
Mhm.
recommendation that we're given is so pie in the sky.
It
And
is.
it's just not, unless you turn that into your day job,
Right.
which we can't, like it's
No.
not attainable. And then we're just like, all right, well, whatever,
Why try? Yeah.
Right.
Yeah.
Exactly. So
Yeah.
what did you guys kind of come to conclusions
Come
about?
to
Like what
conclusions. So I think, there's a lot of ways you can get some extra protein. If you, are dairy intolerant, it might be a little harder because we do have a lot of sources that happen to be dairy based, but there are a lot of options that are non-dairy as well.
Yeah.
But sometimes just having those protein shakes,
Yep.
chocolate milks, things of that nature, if you can add one of those to your, your liquid diet during the
Yep.
day, that can be a huge addition of protein. I think a lot of women enjoy or wouldn't mind eating Greek yogurt. So if you're
Mhm.
already eating yogurt, choose the stuff that has some protein in it. Even some of the cottage cheeses, more protein in that. Most people think you can only get it from, meats. But
Mhm.
of course, chicken is going to be good. Salmon's going to be good. Red meat is going to be good. Lean ground beef that's grass fed is a good source. So if you like your taco night, go for that. And there's lots of vegetables that have some protein, including beans too.
Mhm.
So, without micromanaging your day, you could try using some apps, but even just being more conscious of, I'm going to buy the Greek yogurt instead of the regular yogurt, or I'm
Yeah.
going to try to add one of these protein shakes every day instead of not having breakfast, or, those kind of things I think could be some basic steps to try to start getting a little bit more protein.
Yeah. Where I think there's a leap for our generation
Hmm.
is we grew up with the Weight Watchers commercials. We grew up watching our moms diet.
Diet.
We
We
grew up
did.
being taught that we should be dieting
Mhm,
and doing
mhm.
calorie deficit. And you kind of allude this. You had another paper a while back looking at adult female endurance runner,
Yes.
looking at like energy deficiency and that
Deficiency.
sort of thing. Yeah.
Mhm.
And
Yes.
so I think for our generation specifically,
Mhm.
we very much have that calorie deficit, lose weight
Absolutely.
in our DNA because that's what we were surrounded with.
Agree.
Maybe it worked in postpartum. Uh,
Mhm.
we used exercise to lose weight or to manage our weight, and then
Right.
now we're being taught, "Don't do that, and oh,
Mhm.
by the way, eat more," and it
Right.
can be quite, there's a lot you've gotta unpack there. So
Mhm.
we can kinda take a little sidebar over to energy deficiency. We've had a bunch of
Sure.
guests
Yeah,
past, talk
absolutely.
about this and,
Mhm.
low estrogen state and in lactation times, like, paying
Yes.
attention. But I'd love to hear kind of your thoughts on it.
Yeah, no, it's definitely when I did the paper a couple years ago, we just kind of looked at signs and symptoms of low energy availability, and the population happened to be women who are in their 40s, and there definitely was potential for low energy availability in runners that are in their kind of midlife, and I do think you brought up some good points of just some societal influences that have kind of led to this, I'm going to eat less and I'm going to
Yeah.
over exercise.
Yep.
But then when you're feeling depleted and you're trying to hit workouts and do certain distances and times, then you're not able to because you need the fuel.
Yeah.
So, we get into this deficiency of estrogen as well. It really becomes even more important to consume calories because we are losing muscle mass.
Yeah.
Our bone health is getting affected. And so without the fuel, and specifically our calcium and our vitamin D, we're really we're not doing our bones a service whatsoever
Right.
in
Right.
the consumption or the failure to consume adequate calories.
Yeah, and it's
Mhm.
not just like, day-to-day stuff, it's while we are exercising as well.
Mhm.
And,
Absolutely.
you had looked at, the female endurance runner.
Right.
I'm a huge fan right now. I'm totally fangirling the ultra community, not because I can do that distance, but
Yeah.
because they just talk about food all the time,
Mhm,
which
mhm.
I think is amazing. And they
And
talk
food
about
as
these
fuel,
subjects. Yeah.
it's a whole 'nother perspective, is food as fuel
Yeah.
rather that food is bad and I need to try to survive on as little as possible.
Right. I mean,
Sure.
think back to how old were you when you started doing triathlons?
I was in my early 20s.
Okay.
Yeah. Mhm.
So back then, do you remember what were you being taught in the tri community about fueling for a triathlon?
It wasn't to consume a lot. It was
Yeah.
to consume as much as you need, but as little as possible, you
And it was
know?
like chew food. It wasn't like we didn't have all these fancy things
It
that we
was
do now.
chew and it was gel and things of that nature. Maybe, yeah, it wasn't real food, which, like you said, in the ultra community, it is about sustaining that long endurance
Yeah.
and in fueling the body appropriately. Yeah.
Yeah.
Well, yeah.
But I also feel like back then too, and I'm sure, age and hormones and stuff have changed it, is like,
Yeah.
I feel like we could get away with more back then. Like
Oh, I think so.
I could do a 10 miler and
Mhm.
maybe take whatever was on the course as far as Gatorade and water goes and not feel depleted. I did
And
a
be
10
fine.
miler, it was like 3 years ago.
Yeah.
Same strategy, totally bonked. Actually fueled last year, and imagine that, I felt so great at the end.
Amazing. I know, I know. I joke I came out of marathon retirement, this year, and I
Oh,
ran a
congrats.
marathon. And, I kinda had to relearn, like, what am I gonna
Yeah.
do that's gonna work for me and my
Yep.
body in this phase of life, and
Yeah.
from a training perspective as well as that fueling perspective, for sure.
Yeah. No, I feel like I almost because I mean, I just did Army 10 miler, I guess it was like 2 weekends ago, and
Mhm,
I will take a gel about 15 minutes before, and if I'm
mhm,
running longer than an hour, I take another one about every half hour, between every
mhm.
half hour, 45 minutes or so. So
Yeah.
I took 2 during the race,
Mhm.
and I bring an extra just in case because you never know.
Never know.
And so in some respects, you're almost like a little embarrassed walking into a 10 miler with 4 gels, but it's like, that's kind of what I need, and I don't feel like
Kinda what
shit
you need.
afterwards. So
Absolutely, absolutely, and that's the thing, you gotta try that stuff out, and I mean, I'm not a
yeah,
sports scientist by any means with looking at all the different elements of sports nutrition, but
right.
I do think you have to explore and you have to experiment with that stuff
Mhm.
in training to see what leaves you with enough energy so that you can
Right.
sustain the distance of the event that you're participating
Yeah,
in.
exactly.
Absolutely.
So
Mhm.
that is primarily carbs,
Uh-huh.
and then after, I've been playing with having protein within a half hour or so when I come
Absolutely.
back from the gym or the workout.
And that's
What
recommended.
Yep.
Mhm. That is recommended. I think we touch on it in the paper a little bit about doing something right away that's got some, protein in it as well as a little bit of carbohydrates. Yeah,
Yeah.
definitely.
So
Mhm.
trying to simplify it as much as possible. Like if you had to give like a couple of top tips,
Sure.
somebody, and just like a basic exercise one, a basic nutrition, and then like another grab bag. Like what would 3 just super simple, actionable,
Yeah.
easy, you've got a couple of kids, you got a full-time job, you're trying to do the right thing. What would those 3 things be?
Yes. Oh, woo, that's a tough one. I wish we could
Sorry.
wave that magic wand. Yeah, I mean, I think like the big 2 nuggets about training through menopause, I think, are there's a decline in estrogen and it's affecting every single one of our systems. So we've got to be mindful about protecting our systems. And I think the first thing we can do is really, I think adding some protein into the diet could be an easy win,
Yeah.
especially for an athlete. And again, my go-to, I kind of like the Orgain protein shakes. 30 grams of protein as a post recovery seems to work with me, and it may not work for everybody. But I think that's helpful. I personally like to eat cottage cheese. I like to eat yogurt, but I do have that sometime later in the day. And then I kind of drink milk. I drink chocolate milk kind of like throughout the day with dinner, things like that. It could just be a matter of adding in a little bit of that.
Yeah.
If my kids don't like regular milk, so guess what? We have chocolate milk. So
Who cares?
yeah, I'm like, you gotta get some vitamin. And we talked about bone health and try to get that going in a positive direction from a
Yeah.
young age. And my 2 teenage girls, I'm like, let's get that chocolate milk. And I
Yep.
mean, as long as I know they're getting some chocolate milk and, maybe get some cheese on a sandwich or something like that.
Yeah, totally.
So point number one probably is just the awareness for all the things that are happening. Number two would be adding in some easy protein throughout the day. And then number three is really getting to some strength training in.
Yeah.
And strength training combined with recovery, like adequate recovery, whether it's rest in between the sets or just rest in between days of training too, and
Yeah.
allowing that rest period, because we do need to have recovery. And we
Mhm.
didn't get to touch on this, but sleep gets a little disrupted during menopause
Yeah.
transition too, and that can leave people who are training feeling fatigued. And so maybe the sleep is more important than getting up to do that workout, and kind
Yep.
of extending yourself grace and helping your patients give grace to themselves.
Yeah. No, and that one almost parallels postpartum again as well,
It
because
does.
that's definitely you're not in
Sleep
control of
deprived.
your sleep.
Mhm.
You're sleep deprived. And we have those conversations. I'm like, if your baby is not sleeping,
Yeah.
if you are in, one of those weeks or whatever, I
Mhm.
need you to choose sleep over the
Back off.
workout,
Yes,
which is
absolutely.
hard. It's almost like they
Hard.
need permission to do that. I'm like, we're playing a long game here.
That's right. That's
Um,
right. Yeah.
but I also too, again, this is another one that I think I very much remember as a kid. I would have like my New Year's resolutions and be like, I'm
Mhm.
going to exercise every day. Or even in college, like having like I'm going to go run every day. And it was like a thing.
I
And
know.
I still people now, they're like, oh, I've run, 365 days in a row. And I was like, number one, good on you that you have the
That's right.
physiological resilience to be able to do that. I do
Mhm.
not.
Right.
Nor do I have the desire at this point. But
Yes.
I very much think that was, if you're not exercising, and I saw something today on Strava, or it was like on Twitter, but it
Okay.
was a Strava comment that like, if you have the paid version, I do not.
Okay. I
Um,
don't either.
like Strava's, I think the comment like Strava, how like watches are like, you're not being productive today. It
Oh,
was one of
unproductive.
it
Yes.
was one of those comments where it's like, you could have gone for a run today, but you chose to do something else. And it was like really snotty. And I was like,
Sometimes I choose to rest, and
no,
sometimes
right,
choosing to rest is the right choice for that day.
right. Well, and I think that's where, again, I love wearables. I'm a huge Whoop fan.
Yes.
I've been wearing Whoop since like 2019.
Okay.
And to be able to look at your recoveries,
Uh-huh.
and like the days that I go to the gym, I need to recover the
That's
day
right.
after. I
That's right.
can't, and even the days, this has been a new kind of revelation, is the days that I am in clinic,
Uh-huh.
my strain is equivalent to basically running 6 to 8 miles.
Yeah, because you're active in the clinic for
It,
sure.
and it's a performance. I'm not going to lie. Like you are
Yeah,
on, you are like
you
all the
are.
things you're thinking, you're talking, you're,
That's right. You're
moving.
delivering. Mhm.
Yeah,
Yep.
exactly. So
Yep.
knowing what your energy expenditure is
That's right.
for your work, for your activities, for your time with your kids, understanding that and understanding where you might need to sleep in and maybe not go to the gym or something like
Yep.
that.
And to be okay. It's
Yeah.
gonna be okay. In the long run, it's gonna be beneficial. And then you just make your next workout even
Right.
better.
Yep.
Yeah.
Yeah, no, and rest really needs to be a part of that, and I don't think that was part of what we were taught growing
No.
up as kids, that
No.
rest was like, "You're lazy."
Yep, I know. I try to put that on the paper. Recovery is a part of training,
Mhm.
and it should be in there. It's not eliminated. You got to put it in there. So,
Yep. No, I think
absolutely.
it's super important, but so much I like that you kinda hit these basic topics that I feel like are so much of what we're talking about, but
Mhm.
again, I think what's important is we don't have this algorithm yet, and
We
there's a
don't.
reason for that,
Yep.
because, again, you've got people in different ages that they enter perimenopause. Perimenopause
Yes.
lasts a different amount of time for different people.
I know.
We've got all sorts of different demands in our lives, things that we're trying to accomplish, stressors, things like that. Like, it
Absolutely.
really does have to be individual, but starting with your baseline of, okay, I want to do something. What am I doing right now? And this is what I do with my
Mhm.
patients too, is like, you can't change what you don't notice. If you just take notice based on the recommendations you just gave, like, how much protein are you
That's
eating?
right. Yeah.
How much sleep are you
Are
getting?
you
Can we
getting?
make small little changes instead of trying to change all the things which inevitably is why we don't
Exactly. Exactly. And
do
asking
anything.
what seems the most reasonable. Which one of these seems
Right.
easiest for you? Like, which one do you think you could
Yes.
do?
Low hanging fruit,
That's
people.
low hanging fruit, and the strength training piece might be like, well, I don't belong to a gym and I don't have access to equipment.
Hmm.
Okay, well, what could you see
Right.
yourself doing?
Yep.
Could you see yourself joining a gym? Could you see yourself joining a
Yeah.
friend and doing some walking and doing some things with like a weighted vest or something
Yep.
like that? So,
Yep.
yeah, I think there's a lot of opportunity, and it really does start with education and awareness.
Hmm.
And I think that is this we're kind of at a state where there's a movement for sure,
Yeah.
on helping women through menopause, and hopefully the active woman is adjusting things accordingly.
Yeah. No, and again, that's where I feel like, our profession, and again, regardless if you're pelvic health PT or some other type
That's
of
right.
PT, like if you are in contact with women who may be perimenopausal, you are in a place of influence. You are in a place where you can
Absolutely.
educate and provide and screen and help people understand,
Mhm.
you know what, you
Mhm.
may have a higher cardiovascular risk because of X, Y,
Right.
and Z.
Right.
Maybe you need to attend to some of these things first, or, oh, you know what? You're missing this in your
Mhm.
exercise program and you're
Yeah.
seeing them for tendinopathy or something along those lines. Let's see if we can adapt that too. But
Yeah.
I think this is, in our effort to for people to understand what PTs can do, which isn't
Absolutely.
that literally been our entire career.
Yeah.
Um, we can Everything that you talked about in the paper is stuff that we can either speak to as experts ourselves or refer
For sure.
to like your colleague who's, a specialized
Absolutely.
dietitian or something along those lines. So,
Yeah, I actually have an active study going with two other clinicians, and we're screening orthopedic and outpatient and acute care physical therapists and occupational therapists to see if they're screening for menopause.
yes.
So we're trying to get an idea of like, is anybody A, educated, and B, even thinking about this with their patients?
Mhm.
And if we start to link in musculoskeletal pain, I
Yep.
think that we have a huge opportunity as physical therapists to influence those
Absolutely.
individuals. Yeah.
Absolutely. No, and for the most part, people like us, so, they'll listen to us, right?
Mostly. Yeah, yeah. Most of the
For
time they
the
listen
most
to us
part,
too. Definitely.
when they accuse us of pain and torture, but
That's
that's
right.
that's not us though, because we don't do that. So
We don't.
anyway, all right. At the end of every episode, we ask a couple of questions. So
Okay.
first one here is book you're reading or podcast that you're listening to right now.
Okay, I am reading The Wedding People.
Ooh,
It was a book that was on Jenna's book list
okay.
for one of the years this year, and so far I'm only a couple chapters in, but that's what I'm reading right
Good
now.
book. Gonna
Yeah,
finish
it's
it.
good so far. Yeah,
Okay.
it's this. It's interesting. I think it's a great read for probably this vintage.
Okay,
Yeah.
cool. Are you the type of person that if you get into a book and it's not good, that you still make yourself finish it, or will you just bail?
Ooh, that's a great question. It really depends. I'm often reading like 2 or 3 books. Sometimes I'm reading a book to
Me
help,
too.
with my teens, so I'm reading Untangled for my teenage girls, and then I'm reading, How to Help Your Child or What Your Child with ADHD Wish You Knew. So I've
Okay.
got that on the side table too, but I don't because there's always another book to read, so I'll just stop.
And sometimes you just have to go for like summer smut, like
That's right, that's right. Sometimes I'm like, this isn't working for me. Let's just end this
yeah,
and find a new relationship."
exactly, exactly. All right.
Yes.
Favorite activity. And you've got 15 years to choose from here. Favorite activity since becoming a mom.
Oh, I think my favorite activity, I still like when we get and we do our family dinners because
Mm,
sometimes they get a little bit wonky with school and sports
yeah,
schedules. And so when we really have a good family dinner, that's probably my most favorite activity. And it
yeah.
happens regularly, but sometimes it's real quick and sometimes it's a little bit longer. So
Yeah, and I don't think I mentioned on air, but like your kids are 11, 13, and 15.
that's right. That's right.
And so our we don't get as many of those family meals
Hmm.
anymore because of sports schedules. And then
That's
my
right.
husband works, we're on the East Coast, he works West Coast hours.
Yeah.
And so it's
Yeah.
not when I was a kid, like both my parents were teachers, so that didn't hurt. Like
Right.
we sat down at the
Every
table
day.
after sports practices were over. My parents were probably
Hmm.
at the practice
Yes.
and we watched the nightly news, and we didn't start eating until my dad was there. And it was this very like orderly, 1970s, 1980s
That
household.
sounds about right. Yep.
And you sat there until your plate was clean.
Yes, I very similar experience.
Yeah, we don't have to clean plates in my house.
Yeah,
So my kids don't throw up if they're eating squash and they gag or anything
that's
like
right.
that.
Yeah,
So,
a couple bites.
right, exactly. All right. One piece of advice. I'm going to switch this for menopausal moms.
Menopausal moms. Ooh, give yourself some grace
Mm,
and give yourself some grace and know that you're not alone and that small things can lead to big rewards, but just to give yourself some grace because there's a lot going on. And I think for perimenopausal moms raising teenagers, it's a whole another
mm,
ball game.
yes.
One day at a time. I always try to look at the big picture. Right now it's like, will this be a big deal in like 3 hours? Will this be a big deal in 3 days? Or
Hmm.
what about 3 years? Probably not in three
Yeah.
years. So, but I think I've worked hard to kind of try to give myself some grace. And I would give that advice to others too, is that
Yeah.
it's okay if you have a bad day. Just recognize that those are going to happen.
I was smiling when you said that because 99% of the time that I've asked that to postpartum moms,
Yes.
the answer is the same.
The
It's the
same.
same.
Yeah.
It was the exact same
Same.
answer. And
Yeah.
we were just talking briefly before we hit record about how this stage with tweens and teens is
Mhm.
hard and we miss the
Mhm.
simple stuff. I mean,
Mhm.
it's good. I mean, like it's
Yeah.
cool to have conversations with your kids and things like that, but
Absolutely.
dang, it's tough.
It's tough. It's tough. And the little eyes, the older eyes are still watching. And I think
Hmm.
up your communication a little bit and just
Yep.
express how you're feeling so that you're still, you're just being honest with yourself and honest
Yeah.
with the people around you. Yeah.
Yeah. 100%. 100%. It's hard.
It
It's
is.
hard.
It is. It is.
All right, who is somebody, and we can talk about all, any space that you're kind of playing in right now, but who's somebody in like the menopause space
Yeah.
that you're fangirling over right now?
Yeah, well, I love Dr. Mary Claire Haver. She just wrote
Hmm.
the new book, The New Menopause. I think that's a great book for ladies that are interested in learning more about menopause. And from a musculoskeletal pain perspective, I'm really liking Dr. Vonda Wright. She just
Yes.
wrote a paper,
Yep.
and she happens to live here in Orlando, but somehow she's really hard to get in touch with and connect. So I'm trying to connect with her, but I do think from that sports and orthopedic PT background that I have and thinking about musculoskeletal pain from a PT perspective, there's a lot
Yes.
of opportunities, I think, for PTs to serve the population. And now that she's coined the term musculoskeletal syndrome of menopause,
Yep.
I think that is something that we have a lot of opportunity with. So,
I
yeah.
think so too. And I think
Mhm.
that nomenclature specifically because in our world, we have genitourinary
That's right.
syndrome of
That's right.
menopause. And then
Right.
actually, what just got coined was genitourinary syndrome of lactation. So we're
Oh, okay.
probably going to pull in, musculoskeletal syndrome of postpartum. Like
Yeah,
we just need to have one big old umbrella that says we're going to
that's
have a whole
right.
bunch of crap go on when we have low estrogen.
Yes, yes, I know, I know. Well, I'm taking the North American, well, now it's the Menopause Society's
Oh, you
certification exam. I am
are?
sitting for that
Ah.
tomorrow. So I'm like,
Oh my
ooh, like
gosh.
crossing my
Okay.
fingers. We'll
Okay.
see. But I've been studying up on some of the things. So hopefully
Okay.
my brain produces some good results.
Well, we'll chat about that. I'll give you some time to recover and, the
Yeah,
PTSD, that kind of stuff. But yeah, that's something that's been on my list too. I did hear
that's
that
right.
there's a lot more like prescriptive stuff that isn't obviously as
That's right.
applicable to us
That's right.
because we cannot prescribe as PTs. But I also think
Correct.
it's incredibly important to understand
What's
um,
available.
again, going through this
Mhm.
now when it's not exactly straightforward, like what do those options look like and being able to have a
Absolutely.
conversation with the patient about, okay, here are the benefits here.
Yes.
And here might be
Yes.
some areas that we might have concerns and so
That's
on.
right.
So, okay, cool. Well, good luck.
Awesome.
I can't
Thank
believe
you.
you're talking to me the
Yes.
day before doing that. I would be like
I don't
pulling my hair
know.
out.
I don't know how that got scheduled. I just think I was not aware, and I'm like, oh, okay.
That's
So as soon
okay.
as we get off air, I'm going to go ahead and hit the books one more like
Okay.
study session.
Very nice. Cool. All right. And then last question. What does it mean to you to be an active mom?
Well, I think it's being a good role model, really, for my kids, and I'm probably guessing you hear that a lot too. But I do think I want to lead by example and try to live a healthy lifestyle and put lifestyle and fitness and wellness kind of at the priority of our family values, so that can hopefully raise some good people that, continue those habits.
I love that. I love that. All right. If you want to know a little bit more about Carey, if you have questions for her, she's not on social that I could find.
Not really.
We gotta pull. Well, it's a interesting place. Sometimes it's better to learn.
I know.
Sometimes it's better
Maybe
to
one
lurk.
day. I might put that on my New Year's resolutions for 2025.
Well, you can lurk, and then whenever you have new papers, then you just DM me, and we get an excuse to chat again. And
all right,
that's
sounds
all
great.
good. So you can find her, Carey.Rothschild at ucf.edu. Dr. Rothschild, thank you so very much, not only for talking to us the day before your exam, but sharing all this information. And thanks for being on the show.
Yeah, thanks so much for having me. I really appreciate the invite.
Did you enjoy the podcast? If so, leave us a 5-star review on iTunes and tell a friend to do the same. Are you a postpartum mom or postpartum pro wanting to know more about getting back to running after baby? Check out all my free goodies on careypagliano.com. This podcast represents the opinions of Dr. Carey Pagliano and her guests to the show. The content should not be taken as medical advice and is for entertainment purposes only. Always consult your healthcare professional for any medical questions.